Thank you very much. Well, this is another great collaboration, and as a storyteller myself, I'm delighted to be here to help you to tell your story. And Leslie mentioned earlier the $1 million that is going towards bringing these three great organizations together and the center to look at this issue of digital technology and the really huge problem of transportation, especially for the senior population. 3.6 million adults fail to turn up to medical appointments every year, or at least postpone them because of transportation issues, and a lot of those people are seniors. So, Jim, maybe first of all, tell me what your organization is and your vision for this collaboration.
Sure. My name is Jim Murphy. I'm with United Healthcare, Medicare, and Retirement. And what I would say is we really embrace the notion that Dr. Saxon put forth, which is I don't think there's been a greater time in history relative to opportunity to be able to better serve seniors and be able to close gaps in care. And we think that transportation is a really extremely component of that. So just a few table setting comments before turning it over for some conversation. So one is we, United Healthcare and Medicare and Retirement specifically, are very much aligned with the notion of the triple aim, creating better care experience, creating better health outcomes while maintaining affordability. And we look to do that really in a couple of different ways. So first and foremost is really taking a whole person approach to care. So going beyond standard coverage and access to networks, access to care, but really looking to try and address the whole person. And two is we believe that technology is an extremely important, critical way of being able to do that, to be able to achieve that goal. And so what I would say is that we serve our Medicare populations in many, many different ways as it relates to technology, and some of them rather unexpected. So just to give a few examples. So one is from a customer service perspective, to be able to address transportation, to be able to address gaps in care. So whether it's an outbound campaign or whether it's an inbound campaign that has member-level knowledge when someone calls into the customer service area. So whether it's the member or their authorized representative, to be able to say, okay, you know what, we see you haven't had your annual wellness visit yet. Let me talk to you about why that's important, and let's go ahead and schedule that appointment for you. And if transportation is an issue, let's address that as well. Through clinical programs, and clinical programs are also leveraging the data that we have access to on our members. And to be able to understand an individual and understand their needs, understand the perhaps chronic conditions that they have, and be able to address them through various different methods of technology. So there are many different aspects of our care management programs, but just to cite one, which I think is a really powerful one, which is congestive heart failure patients, which we know have very unique needs. To be able to enable a digital scale in home that is monitoring their weight, and if there's an adverse event, if there's an outlier as far as that data goes, to be able to create an intervention and take action so that we don't have a seriously negative health outcome for that member. That's definitely a clear example relative to a care management program. And I think lastly, when getting back to the whole person, is we recognize that social barriers play a significant role in keeping people from achieving their best health. So if our mission is helping people live healthier lives, an important component of that is going beyond standard coverage, going beyond access to care, and basically addressing those social barriers, whether it's nutrition and people are food insecure, whether it is they have threats to their utilities being turned off, as an example. Or I think the last one is transportation. So while we provide transportation to our Medicare populations as a supplemental benefit, we also know that that doesn't solve for all. So we have community-based programs where at the county level and down to the member level, we're able to identify when transportation is an issue, identify a local resource to be able to help solve for that, and be able to connect them with a ride program in their area. But once again, we know that's a that's a quilt work of a network nationally, and that doesn't solve for all. So knowing how important transportation is, we also look to regularly create new programs, like the one with AARP Foundation, USC, Center for Body Computing, and LIFT.
This is a really exciting program. At least maybe you could sort of flesh out this project a little bit, because this is an age-old problem, isn't it? Access to transportation, not just for medical appointments, but you mentioned the whole person, for the entire lives of an elderly person. That feeling of being isolated, loneliness is such an issue that this could go a long way to solving.
Yeah, it really could, Peter. Thank you. And thanks, Jim, for great background and reminding us of the importance of the triple aim. It's really great to be here. President of AARP Foundation, as you heard. You can also call us ARP, and we'll answer to that as well. So at the AARP Foundation, we focus on innovating, finding solutions to the social determinant problems that low-income, vulnerable older adults face. And we know this, as you're saying, Peter and Jim said, this is about a whole person living in community, so it's contextualized. And it really does require all of the great collaboration that you heard about in this morning's talks. And we're a good example, USC, United Healthcare, and LIFT, and AARP Foundation, of bringing disparate organizations together to address the problem. But social isolation is one of our main areas, because social isolation actually increases mortality risk. And 1 in 5 older adults over the age of 65 or older suffers from social isolation. And let me tell you that sustained social isolation is the medical equivalent of smoking 15 cigarettes a day. And so these are very, very real healthcare, negative health outcomes for older adults. And there's no sort of bumper sticker or social media banner ad that could describe to you all of the causes or the solutions, but I guess I would say that I'd want you to know that connection matters in people's lives, and as we're saying, in the lives of older adults. No surprise to you that 90% of older adults, just like all of us, want to age in place or live as independently as possible in community. And so transportation is key for that. Having access to reliable, safe transportation to get older adults to really life-protecting medical appointments. So this pilot will test out something that is so necessary for older adults, keeping up with preventive medicine, getting to subspecialty appointments, as Peter said, up to 4 million missed a year. So we know the evidence says this will be important work. But the reason why we've partnered with this grant to have unlimited access to other rides is that social connections, maintaining the number and range of your social network, is very, very important. So getting to the grocery store to buy good food, getting to the senior center or other activities that help older adults remain connected will help us balance the health outcomes. So we're excited about it. United Healthcare has been a huge co-creator and smart collaborator with AARP Foundation over a good number of years, more than 17 actually. And this work with USC, United Healthcare, AARP Foundation, and LIFT is a $1 million grant, which is part of, I'm really proud to say, Jim's being humble, a $6 million body of support for AARP Foundation in finding solutions for social determinant work that we're engaged in. So stay tuned. Our goal is to build a body of evidence that will help us understand how we use an existing platform. So what's so great about this is technology can help us replicate and scale, right? We've talked about this all morning. The platform exists. We're going to build evidence to see if we're improving health outcomes by encouraging older adults to get to these appointments and other necessary social connections. But we will also learn a ton about how older adults are using the platform and what may or may not need to shift to encourage more broad-based use of ride sharing among older adults so that they can remain connected to the social fabric work in their communities that's so important for them. And although we may think older adults don't use technology, many of you probably read the recent Pew study that showed that the rate doubled to 4 in 10 just since 2013. For those who are 60 to 69, it's actually 59%, and we understand the exponential power of that. So very quickly, we'll be working with a body of older adults who are very comfortable or facile with technology as well. So we have to get it right now. I want to also say, Peter, though you're probably going to give me the hook, that I would want you to know that AARP Foundation works with digital health in other ways, and I want to share this with you briefly as points of connection. So last year we awarded through a challenge $50,000 to an organization called Care Angel, you might know about, in Miami, and testing out with them the use of natural language and voice recognition to make calls using landlines to older adults about medication management, how they're doing. We just launched a challenge. I want you to shout this out to your networks. AARP Foundation and Rock Health, $50,000 prize again, looking at digital health startup innovations to reduce, ultimately, hospital readmission, because even a short stay increases the likelihood that an older adult must leave their home, go into a nursing home by 23%. So other ways that we could work with you.
Dan, can you talk about some of the practicalities involved here? It's true, more and more older people are using technology, but many are not. And many, I think Leslie mentioned earlier, have a kind of love-hate relationship with their mobile phone. I heard a story of a man recently retired who was about 70 years old, actually a retired doctor, and he was struggling with his mobile phone, and he was tapping and he was swiping and he was pressing, and he was unable to achieve what he wanted to do, and he just threw it down and he said, "I hate the modern world." Just in frustration. How do you persuade people like that this is a good thing?
So first of all, I want to thank Jim, Lisa here for having us today. We are extremely grateful that AARP has leaned into this initiative. So I help lead healthcare partnerships at Lyft. I lead all our efforts around what we call elder mobility. The one thing, before I answer the question, that I can't stress enough is our mission statement at Lyft is to improve people's lives with the world's best transportation. That is core to our DNA, is what our company is made of. And for our elder, at-risk, low-income population, we think our platform can have a tremendous impact. So my team and I, we have partnerships with hospitals, health systems. We work with senior living operators and home care providers. We do work in clinical trials. Clinical trials only as good as that patient showing up to take their medication. How do they get there? To your question, as what we found is about 30 to 40% of our elder population doesn't have a smartphone. May not know how to use all the features of a smartphone. So natural question is, what good is this? Is Lyft to this population? So we've developed a platform at Lyft that we call Concierge, where it allows our partner to request a ride on behalf of the people they serve. So I'm a patient coming out of Ascension, one of their ministries that we work with. The case manager, social worker, can access the Lyft network and request a ride on behalf of that patient. In our partnership with AARP, they will be able to do it on their own on the Lyft app, and we're going to be doing a lot of training for this population and working with AARP around that training. But they're also going to be able to call a phone number to request a Lyft ride. So there's other ways that this segment of our population can access Lyft. And I think real quick, just so you don't just hear me talk about it, I think we want to show this one quick video that illustrates everything that I just shared and give you a little bit of an insight how it works today.
I used to love to drive a car, but with my age, I realized that my reaction time was not as good as it should be, and I was becoming a road hazard. I'd like to request a Lyft ride, please, to the florist. That soon. That's great. I'm very happy that we have Lyft because it will give me freedom that I haven't had. From my apartment, I can call the front desk and they will call Lyft and I will be downstairs and within a few minutes Lyft will be there, take me to where I want to go.
Hi, Lisa. Come on in, Pat.
It's very, very convenient.
Okay, let's go.
I love community living. I do a lot of things at Brookdale. I am a painter, so I paint. Also, I sew. And on Friday afternoons, I plan to go to San Francisco to the Museum of Fine Arts up there, and also the newly renovated and newly opened Museum of Modern Art down on 3rd Street. It's gorgeous.
You're welcome. It was nice to meet you. Thank you. Okay. So you have a lot of plans with Lyft.
I do, yes. It's almost like having a car. only I don't have to buy the gas or park.
So one thing real quick just to talk about this. So I've spent a lot of time with Pat. I go to senior living communities and people's homes all across the country to learn about how transportation is so important to them and how we can help. Dr. Saxon did an amazing job earlier when she kicked off the conference today, talking about her mother and taking away the keys, one of the most difficult conversations we can possibly have with an elder. I'm first generation American. My family, my sister, my grandmother came to the US, and my grandmother was 90 years old living in an apartment in New York City. The only time she would leave her apartment was about once a week when my dad and I would visit her from New Jersey. So imagine if I was able to request a lift upon her behalf and have visibility into where mom is or grandma is during that trip. And without doubt, we believe we can have a significant impact for our elder population. And that's why we're very excited by the commitment from United Healthcare and the work of AARP.
And Jim, I'm wondering, looking forward, if this takes off, if this service is available in every city in America, is there the money within the system to support it?
Yeah, I mean, I think it's absolutely critical that this scales for not only the tactical reason of trying to create a preventative approach to healthcare and getting someone to a doctor's appointment, but for all the reasons that Lisa and Dan said. Loneliness is a huge factor that needs to be addressed. So we're hopeful that this program rolled out here and a couple of markets that we're looking at in 2018 will take scale to be able to close the gap on both fronts.
And very important, Lisa, on that point, loneliness, it's not just educating this community we're talking about, it's their carers, it's their family as well.
Yeah, no, you're right, Peter. It really is a growing public health concern. So we all have to be educated about the threat of loneliness and what we can do to be, it sounds simple, but be better neighbors, really looking out for people. Along the lines of evidence, we'll build a body of evidence. Of course, that's why we're focusing in on building a body of evidence about improved health outcomes, which will help us get at the issues, I think, around payment. We also have with us just other solutions that are happening in California. I'm looking over here, seeing Scott Kaiser, who's a Keck grad, and the Chief Innovation Officer at the Motion Picture and Television Fund. And that great video, Daniel, with landline, Scott's working on a project with us where we have volunteers who are calling isolated, using landlines, isolated older adults, also measuring improved health outcomes, and with a lot of, I think, great early evidence. So many ways to get at loneliness.
And the other thing, too, in addition to the loneliness aspect, the stories I hear, I'm a resident living at Brookdale, or I'm a resident living in the community. I don't want to go in a big shuttle that says Brookdale on it to the movie theater downtown. I don't want to take this big bus and have to wait and not be able to go when I want. I have to wait on the schedule of the local transit agency. So it's more than just getting them back out into the community, but it's also about having that same dignity and that same lifestyle that they used to have when they did have their car keys. And with Lyft and our platform and the commitment we have to our drivers and passengers and the way we treat both parties, we believe that it could be a much better experience for our elder population.
Interesting you make that point. I interviewed a 100-year-old lady a few weeks ago, and she made precisely that point, that the assisted living home that she's in provides a bus every day, but 10 people get on the bus and it goes to 10 different places. She says, I don't want to spend all day on the bus to go to my physical therapy. She resolves that by actually walking the few blocks that she needs, 100 years old, and she manages to do it. But the point being that it would free her up to do and live her own life. She is actually quite depressed because she's in there, and she's lost her independence, she feels.
Yes, and so you're touching on those mental health aspects as well, which are real. And it's about, what we're talking about is the benefit of longevity, and we want it to be a benefit. So we're really thinking about not just lifespan issues, but health span issues. And your podcast with the woman, we're very much about that.
Yeah, that's exactly what it's all about.
Yes.
I'm curious, Dan, in terms of the safety aspect of this and the suspicion that a lot of people will have of just getting into a car with a stranger, that probably most of us are quite happy with that. We understand it, we understand the concept. But a lot of people are not happy with that.
So safety and security is paramount to our network at Lyft and what we've been built on. So all the things we do, especially compared to a traditional taxi provider or a third-party livery service, is above and beyond. So specifically, all our drivers go through a Sterling back check. We do 19-point vehicle inspections. What's very unique to Lyft that no other company out there is doing today is we meet all our drivers. So if you want to drive for Lyft, you go through a mentorship program. You can't do it over just a simple email process. So the way we, unfortunately, I can't be in every Lyft ride, so I can't control how our drivers treat our passengers. But what we can control at Lyft is how we treat our drivers. And if you talk to drivers, more often than not, they drive for multiple organizations. 9 times out of 10, they're going to tell you they prefer Lyft because of how we treat them. And if we treat them with the dignity and respect that they deserve, we know they will treat our passengers just the same. And then what systems do we have in place to ensure the quality of the network over time? So we have our 5-star rating system. If a driver's rating falls below 4.6, we immediately investigate. Zero tolerance policy. So if you've ever wrote a review that said drugs, alcohol, swerving, immediately deactivate the driver. So things like that we can do on a national scale with our network are extremely critical to this population, because we're not taking millennials to a bar in downtown San Francisco. We are dealing with our frail, at-risk population. And for us, it's extremely important that the quality of our network speaks to this segment of our population.
All right, time's moving by quickly. I think we can probably open it up for some questions if anyone has one. We've got some microphones at the back, I think. Right over here.
Yeah, looking ahead to the future of autonomous vehicles, this would remove the benefit of all the hard work and the important work you're doing. And I see a parallel also to using a touch phone to actually call people. Is this, I mean, how are you looking at transitioning this, particularly as people who are in their 50s are pretty fluent with mobile tech, right, and won't need to have some of the older school, they won't need a touch tone phone to do this. So how do you see this transitioning at 10, 15, and 20 years?
I would want my colleagues to jump in as well, but I think my first comment would be that the problem is so real right now that, as you know, we have to address with the technological tools and the availability to address the concern with resources that we have today, all the while working on some of the opportunities, such as autonomous vehicles. It will take a while, I think we all would agree, before they would be available, in particular available to the population that we're addressing jointly, which is a more vulnerable, moderate to lower income population as well. But I'm actually excited about the evolution of new opportunities, and I think with any great innovation, you run it as long as the solution is successful as you're building up a pipeline to come behind or parallel.
And then real quick, from our perspective at Lyft around AV, which we're playing a tremendous role right now within that whole spectrum, it's something that we're very passionate about, and you're going to see an evolution certainly over time. Now, the one exciting thing is with AV, it certainly drives the cost even further down.
That's
so when
right.
you think about the benefits to our elder, low-income population, they're tremendous. But now let's take it to the next level. Imagine you're able to get an autonomous vehicle with a licensed and qualified caregiver in the car with you. They can sit in the back seat with you, attend to you, do a better job, be more productive than worrying about driving a vehicle. So we at Lyft, for example, have partnerships with Comfort Keepers and Home Instead, the largest home care providers across the country, where they're using us for their caregivers. But again, imagine all the additional services you'll have in your vehicle, like a caregiver with that elder. So
the driver role changing, right?
Exactly right. There's going to be other service lines created. So we're still early days in that. But to Lisa's point, there's still a huge need today, and certainly we're going to go a long way in the future as well.
Yeah, and I'll just add that autonomous vehicles may solve for. Hopefully we'll all be 67, healthy, playing tennis, and being able to jump in an autonomous vehicle and basically embrace that experience. I think for those who have mobility issues, when you talk about door-to-door or door-through-door, when you talk about being able to accompany somebody to the grocery store and to the pharmacy and to a doctor's appointment, maybe at the request of their adult family caregiver, that is definitely the new model, and I don't think autonomous vehicles will solve for that. I think it will definitely still require that human touch, because that's really, it's a need now that is now just beginning to be met.
Another question?
Here's one in the back.
In the back?
Yeah, right at the back.
I want to be sure we don't miss them.
I was wondering if
All
there's a way for
corners.
individuals who don't know how to use smartphones or who aren't in a living assisted center where they can just call the front desk to call for a ride.
Yeah, so in this partnership with AARP, we'll be setting up a call center solution where anybody can just call their phone number to request a ride, and then that person on the phone will be using what we call our concierge platform, where they can request the ride for that caller. So absolutely want to make sure we have access to the whole spectrum, those that know how to use a smartphone and are savvy, as well as those who just want to call a number and request a ride.
Yeah, we also at AARP run a number of tech academies so that we're still able in communities across the nation to help older adults in one-on-one learning learn how to use smartphones. So that will continue as well.
Any more questions? Yeah, right over here.
How are you planning to address the accessibility issues? Because from my experience with my grandparents, they are not really able to move around, walk, and not all lift rides will have wheelchair accessibility or anyone to take them out of their homes into the cars.
Yeah, so very good question, very important question. So we're not suggesting that this platform is going to be 100% fit for everybody today. We're very focused on ambulatory curb-to-curb transportation. Now, the one thing I'd point out, there's no additional cost for more people in the car, so a family member, caretaker, caregiver can always accompany them as needed. In a handful of markets across the country today, Lyft does have wheelchair-accessible vehicles. We partner with local operators who specialize in that and onboard them to our network. As you can imagine, they're never at 100% utilization. We help get more supply to meet, more demand to meet their supply. It is a very important area of focus for us. So as we grow, we want to have stronger wheelchair-accessible vehicle fleets across the country. It's something that we are very focused on. But for this pilot in particular, that's where the administrator or the case manager or the person who's administrating the program, they serve as a filter. Again, it's not going to be 100% of the patients may be a good fit, but we do believe the vast majority will benefit from this.
Lisa, that goes into the whole trust issue, doesn't it?
It does.
That if you get that right, that you're going to bring more people on, people are going to want to use the service.
Yes, you're right, Peter. So it's collecting the stories. It goes right back to how we began this morning, which is using all of the information that we're gathering through the various portals and feedback you'll get from customers and sharing those stories and building trust and good experiences.
Yeah. Well, we have another minute. Any more questions? No? Okay. No more questions? All right, I'll give you 30 seconds each just to sum up your thoughts on this and maybe explain. So the pilot project starts, in the next few weeks?
Yes, we will. USC is really completing design right now, and will be launched by the end of the fourth quarter, 2017.
Excellent.
I'll just add that we're really excited to see these outcomes. We know it's a huge need. We have developed programs where we've seen benefit in being able to administer these rides in the community before, and we trust that through the work that we're doing with USC Center for Body Computing, that we'll be able to prove it out again. And Peter, to your point before, hopefully bring it to a more meaningful scale.
I think from our perspective at Lyft, the biggest thing is this is just the beginning. We're really just getting started in this space. We're very grateful that organizations like the AARP Foundation, United Healthcare have leaned in to join us in this initiative. We have great partnerships where we've seen some data already. So for example, we work with CareMore here in Southern California, and we had a publication in JAMA talking about reduction in no-show rates, reduction in cost. And now with this study, we'll have deeper data, because at the end of the day, we have to show that ROI. We're confident we will, and we're excited to have this network here to test this in.
Yeah, I would just reinforce what I've shared with you today, that social isolation is a growing public health concern, that there are very negative health outcomes, and that this collaboration is really the best of strategic partnerships, taking 4 different organizations with different strengths and leveraging our unique strengths in a very positive, collaborative way. It's the best of collective impact.
I think it's really exciting. It almost looks like an unlikely collaboration, but it makes absolute sense. Thank you all very much.
Thank you.
Thanks.
Thank you, everybody.
Thank you.